critically ill patients, again, one of the challenges, of course, is the cost. On average, if you were to land in ICU for critical care, we spend close to 71,000 shillings or thereabouts to manage you on a daily basis. 65% of that is contributed to by the PPEs. But on top of that, of course, these are people who have comorbid conditions, and that makes the management more complicated because of the kind of presentations we get in COVID-19 cases. Some of these things which Waziri has alluded to, including the challenges that you'll face with the respiratory system, so you require ventilatory support. That being an invasive procedure puts you at risk of getting secondary bacterial infection in the respiratory tract, which of course complicates your management. Of course, also because of these underlying conditions, you find that these patients end up with multiple organ problems leading to what we call multiple organ failure. So when the lungs begin to fail, in sympathy, the kidneys also slow down, the heart slows down, and you require to support all these organs. Of course, the kidneys, you require to do the hemodialysis to be able to remove the toxins. For the heart, you need to give them medicine for them to be able to maintain good blood pressure for circulation and perfusion to continue. All these are very complicated procedures and processes which take a lot of time of the healthcare workers, and therefore if the numbers surge, then you may not be able to have the adequate ratios of healthcare worker to patient to be able to offer that service. Notwithstanding the clotting problems that these people have, the cytokine storm, where your body in trying to fight the infection overdoes it and therefore puts the rest of your organs at risk. Now the beauty is that you are developing or generating data from our own homegrown cases, and we learn each and every day. So it's important that we do this capacity building, and we have daily webinars with colleagues from across the world in Africa, sharing experiences from US, Spain, China, Korea, and anywhere else. And I think going forward with all this information, if we can be able to bring it together, we'll only get better at managing COVID-19 cases. Our total cumulative cases of COVID-19 who have passed through the ICU is 199. Out of this, we have had 90 discharges and 73 deaths. As of today, there are 36 people in ICUs throughout the Republic. Out of these 36, 18 are on mechanical ventilatory support and 18 on oxygen. But the outlook is very good because now we have locally generated data. And of course, as doctors, the more you manage a condition, the more you get used to it. And therefore, you can be able to put in place interventions which will make a total difference. Nancy's question regarding the deaths, yes, these are community deaths, but these are community deaths not from home-based care clients. We told you that for home-based care, we are using a very judicious and cautious approach to ensure that those who go for home-based care actually qualify for home-based care and will undergo home-based care throughout the 14-day period. So these are cases of COVID which were diagnosed posthumously, that these people collapsed at home or died on arrival at the facility, and because of a high index of suspicion, then we go ahead to test for COVID, and then they turn out positive. Yesterday I think we had 84 people on home-based care. Of course, the data does not flow in on a daily basis because we have to get this data from all facilities. So the numbers that we disclose here will always lag behind the actual number of cases. But so far for home-based care, it has been good. Waziri last week we were within Kwale, and all the 4 people on home-based care are doing very well. Even the cases of Pumwani, the 41, 2 of them have been removed from home-based care from isolation totally. 39 are still on home-based care, but they are progressing very well. And I would like at that particular point to give you also statistics regarding the healthcare workers who have tested positive for COVID-19, who are 450. And one thing that could be working in our favor is, of course, our demographic profile. These are very young people. Out of these 450, 414 don't have any underlying problem. No wonder most of them are asymptomatic and they qualify for home-based care. Only 16 had hypertension, 6 of them had asthma, 3 people reported diabetes, 5 are HIV positive, 1 had hypothyroidism, 1 with cardiomyopathy, and 4 with other cases. So we are quite impressed with this, and we are hopeful that including the healthcare workers who are on home-based isolation, they are likely going to do very well. And all other patients that we select for home-based care, because of our young demographic profile, the outlook looks very good. It's not green. I've addressed the question of Pumwani. Yes, the 41 are part of this. We are there today in the morning to look at on a fact-finding mission, but also to support the county team together with the county health director for health services at Nairobi Metropolitan Services, and to be able to see the interventions that we need to put in place to ensure that the healthcare workers are safe. And my final appeal to healthcare workers is don't leave anything to chance. Please implement to the letter the information that you get from the case management team, from the infection prevention control team, so that you are not only safe for yourself, but safe to serve another Kenyan who may unfortunately come up with COVID-19. Thank you.